Hello, everyone. Welcome to our monthly webinar, How Interoperability Helps Hospitals Improve Patient Care and Coordination Across the Continuum of Care. Good morning, I'm Bonnie Young, the DCH Health Information Technology Program Manager. I'd like to welcome you to our Interoperability webinar. Interoperability is a secure use of exchange of health information. One way Georgia is leading in the interoperability effort is with the GHIN Clinical Viewer. The Georgia Medicaid providers can access GHIN via the Georgia Medicaid Management System known as GAMIS. The presenters today are Lynn Hood and Sandy Majors. Lynn will provide the GHIN overview, and Sandy will share how GHIN is used in the practice as of today. Before we begin the webinar, I'd like to review a few housekeeping tips. This presentation is being recorded. If you have any questions, please submit them via the chat feature or raise the hand feature. We'll unmute the phone lines after the presentation for any questions and conversation. You might have to press the *6 on your phone to unmute the line. The mission of the Department of Community Health is to provide access to affordable, quality health care to Georgians through effective planning, purchasing, and oversight. The Partnering for Success, DCH, and the Georgia Health Information Technology, GHIN, are partnering for success by working closely to ensure that providers and caregivers can access patient health information at the point of care to optimize outcomes and reduce costs. Our Medicaid providers have access to GHIN through GAMIS, which the access is to allow you to get to GHIN based on legal terms and conditions, and then you have free access to GAMIS from that point on. The configuration is through the GAMIS web portal. It's a one-click type of login. All you have to do is actually access all of our terms and conditions first, and then you will have access to patient records and reports. We're going to also host another webinar on November 6th at 11 a.m. We're going to host a webinar that's going to explain to you how you access GHIN through GAMIS and also an overview of the clinical viewer. One of the things that you have to do when you're a GAMIS user logging on to GHIN, you have to go through our terms and conditions. We also have a training video that's on your screen right now that explains step-by-step how to access the terms and conditions only one time. And then we have a training video that will also explain the primary functions and the navigational features of the GAMIS Clinical Viewer. At this time, I would like to welcome Lynn Hood, who's going to give us the overview of GHIN. Lynn, welcome to the webinar.
Thank you so much, Bonnie. I appreciate that. So I want to provide just a little bit of information on GHIN, which is our statewide health information exchange. There we go. So GHIN is dedicated to creating a healthier Georgia through the use and exchange of electronic health information. This way, we can advance patient-centered health care, increase efficiency, and really improve the health of the state's entire population. We have a number of different organizations connected through GHIN, allowing them to exchange information ranging from hospitals and physicians, behavioral health. We are even using GHIN in ambulances, school clinics, long-term care, public health, pharmacies, and government. So we have a large network of connected organizations. We're what's called a federated hybrid model, which means that we don't actually hold clinical data. The patient information remains with the treating provider, and it only flows when there is authorization, when there is a request. And so this allows to keep the data safer, actually. And we don't hold, so we never have access to the data. We don't really, we go through exercises, but it really minimizes the chance of a data breach. We have two primary products. One is Georgia Direct, and the second is Georgia Connected Care. Georgia Direct is part of the Direct Trust Bundle. It's a national network. This is for basic data exchange. Doctors can use their internet and an email program, HIPAA compliant, to send patient information to other authorized healthcare providers. It's a great way to be able to eliminate faxing or reduce faxing. We have had over 600,000 send and receive transactions this year. I think that makes us one of the highest in the country. We have 6,000 registered providers and 343 member organizations. And you can see that this has gone up slightly. I think that we'll probably top out 2018 with our send and receive transactions. The other way we help to connect Georgia is through integrated patient search or query service, and this is Georgia Connected Care. Using this, providers can use their EHR to quickly access patient health data. That's when we pull that data together to deliver the information. We've got more than 14,000 connected providers and have had already more than almost 2 million queries this year. So you can see, again, we continue to grow every single year. And we have 33 million MPI records, individual patient records, available through GHIN. Our connected organizations cover a wide area, 5 state agencies, 5 health systems and hospitals. Wellstar is the latest to come on. There are 4 regional HIEs that work with the providers and hospitals in the state. We have 4 care management organizations, a couple specialty connections, and then through the National Exchange, we're connected to the Veterans Health Administration, the VA, and Department of Defense, as well as surrounding states. So we've had someone go to South Carolina, her doctor can pull up her records from Emory and view everything that's going on with her health. That's one way we keep things, we help improve the health care. So now it's my very great pleasure to move on from GHIN into interoperability. And let me talk about, for just a minute, about our speaker, Sandy Majors. Sandy did a presentation at the Rural Health meeting earlier this year, and I heard rave reviews from our team that had seen her speak about how interesting and useful it was. She's the ERH Regional Director of Operations of Physicians. I just lost my whole screen. For Dormany Medical Center, Emmanuel Medical Center, Irwin County Hospital, and Washington County Regional Medical Center. She has responsibility and has been involved with revenue cycle management, day-to-day operations, ACO participation, population health. And she's the current vice chair of Healthy Georgia and a member of the Executive Council of ERH Georgia. Sandy, please, I'm turning the floor over to you.
Wow, thank you, Pam. Good morning, everyone. I thank you, Georgia Health Information Network and the Georgia Department of Community Health for asking me to share my experience with GHIN. It's an important tool that could help your provider understand their patient's health much better. What I want to do today is to give you a view of an outpatient clinic setting on how you can use the GHIN network to benefit your patients. About a year and a half ago, I started getting emails, and I think I didn't move my screen, so you'll have to forgive me. I started getting emails from Mark Renfro of Healthy Georgia and the hospital IT staff telling me that I needed to log on to the Georgia Health Information Network, and I needed to get all the providers to do the same. Quite honestly, I had no idea what they were talking about. I didn't understand why I needed to put one more thing on my plate to worry about and what the benefit would be to the providers. I had dreaded asking the providers to do one more thing. I bet you all can understand that. Every day, we are bombarded with products from vendors. Some we decide to try, some we don't. But we always start out thinking, why in the world do I need to do this? Before I explain to you how and why we eventually came to the use of the Georgia Health Information Network, I want to share with you how after much education and most likely frustration for the IT staff and Healthy Georgia, I sort of had a eureka moment and thought to myself, this is what I've been waiting for. Barbara was my older sister. In 1999, she was diagnosed with a tumor on her brainstem. Well, you know how that story ended, but what I wanted to share with you was what happened in between that diagnosis and when she did pass away several years later. I was a caregiver for the first 2 years. It was a long and winding road of doctors and facilities and surgeries. And quite honestly, it was a new experience for me being on the patient side. I can tell you about what was going on behind the counter, but I had never really experienced the actual patient side in that particular way. So we went from her primary care to a neurologist to her oncologist. You can see the list of everywhere we went. There's probably more, but it was quite an ordeal. But at every visit of every specialist or facility that I took my sister to, I would find myself sitting in a waiting room trying to write information on little lines on another form, information that I'd provided many times before to a primary care doctor, other facilities, other specialists. And I clearly remember thinking on a particularly frustrating visit as I was once again filling out those blanks on another form, why in the world isn't there somewhere for her information to be stored for all of our providers to see? Now, this complaint's not with the providers. They were caring and thoughtful during the time that any patient and their loved one finds extremely difficult. The complaint is with the system we've encumbered ourselves with and the difficulty of all providers getting information from patients and other providers. That was in 1999, and it took 20 years for that to finally happen. We now have access to the history of the patient's healthcare cycle, and the physicians and other providers don't have to rely on the patient or information on forms to have a good picture of the patient needs, thanks to the Georgia Health Information Network. I'm not a provider, but I've talked to enough of them to know that a huge frustration for them is getting information from the patient and specialists they refer to. From visit to visit, it's hard to know where the patient has been in the healthcare system and what services they had during that visit with another provider or another facility. Will the patient remember? Possibly, possibly not. Do they have that mammogram or colonoscopy the provider ordered on the last visit? Did the specialist who performed those services remember to send the primary care a copy of the report? I feel certain that most of us have gotten a denial for services rendered, such as mammograms, annual wellness visits, lab work, etc., that was performed and paid to other providers or facilities. So the service you just performed because you thought the patient needed it is denied, and you'll never get paid for it. Did the patient forget to tell you that they spent a few hours in an emergency room in another town for the same pain they came to see you for today? Information is the key. And I'm new at moving this mouse, so you'll have to forgive me. We have care coordinators who are dedicated to annual wellness visits, chronic care visits, transition of care visits. One of the best comments made by one of our care coordinators, Kim Taylor, said, and I'm quoting, "When you go into a room with a patient and you have all this knowledge about their care, it makes the visit so much more satisfying and personal." So how do the care coordinators use the information from the Georgia Health Information Network? When performing the Medicare annual wellness visit, for instance, they review the site to get a list of all the physicians the patient has seen in the past or is currently seeing. They see if the annual wellness visit has been performed. Should they perform an initial visit, the GO438, or should they perform a subsequent visit, a GO439? Knowing that one particular piece of information makes a difference in whether you're going to get paid. The care coordinators are able to see if they've had that annual or subsequent in the Georgia Health Information Network. Then they pull a list of medications that may have been prescribed by someone other than the primary care physician. So many patients don't remember what they've been prescribed, don't remember to bring their medications, and so by checking the Georgia Health Information Network, a list can be generated and the provider won't over-medicate or provide a medication that maybe contraindicates another medication. Lab tests that are in the Georgia Health Information Network prevent the provider from ordering duplicate tests. ER visits and hospital admissions are available. One of the ways that we used it this year that really was very beneficial to us was when we reported our quality measures for the ACO, referring back to specialists who don't, through no fault of their own, this is not a complaint to them, but the primary care physicians often don't get the reports that they have for patients they've referred out. But we used the ACO, the Georgia Health Information Network to pull information we needed for our ACO. Did they get the mammogram? Yes. Did they get the diabetic eye exam? Yes. There's the report. The colonoscopy. All of the quality measures that we report for, we were able to utilize in part the Georgia Health Information Network to gather that information to make sure that that cycle of care has been completed, and we can report on that. So what are the benefits for your patients? Most of it is pretty obvious. The knowledge for the hospital admissions and the ER visits really inform the provider of problems they need to focus on and that they don't know about to prevent more of these types of visits. Flu shots, pneumonia shots, other immunizations are available. The patients may not remember whether or not they got the flu shot, or maybe it was a pneumonia shot. They don't really remember. The provider has reliable, up-to-date information and will prevent that duplication of service. That will, of course, save the patient money by not having to duplicate something they've already had. I mentioned the medication because it's really important. We are all spending a lot of time reconciling medications, yet sometimes it's more cumbersome and difficult than we need for it to be. Having the information in the Georgia Health Information Network allows the medication to be reconciled so much more quickly. And it also catches those medications that have been prescribed by an outside physician that the patient doesn't remember and the provider has no way to know. And it gives the opportunity for that provider to focus on the conditions that may need more attention for the patient. How is it beneficial for the provider? It gives an absolutely complete picture of, a more complete picture of your patient's health care. Not necessarily the total picture, but it does provide a lot of good information that they did not have before. It improves the safety of patient care, which is so very important to all of us, by preventing that medication duplication, over-medication, and other medical errors. It eliminates the redundant testing. It reduces the request for medical records for new patients. I'll go back to the way that our staff uses this. I have one clinic that on every new patient that makes an appointment with the clinic, they have a dedicated person, one of the front desk people perhaps, that pulls the records from the Georgia Health Information Network for that patient. No more waiting for the fax to go through, no more waiting for the provider to return the records. That provider has a complete picture as much as possible of that patient when they walk in the door for that new visit, that initial visit. So it can reduce anxiety on the provider's part, because you know that that there's a good chance that something will be missed by the patient that is critical to the care of that patient. And I've mentioned it can increase your quality scores because you have good information to close all those gaps. So, you know, maybe someone has come in for an annual wellness visit, but there's other things to address as well. And maybe they've had some of those services and maybe they have not, but it gives you that opportunity to pull those records and look to see exactly what has occurred. So, are we there yet? No, I don't think so. We have a long way to go, but just thinking back to 1999 with my sister, I can tell you that the improvement, the technologies that we have available today would, if she were here today, that technology would reduce anxiety. It probably would not change the outcome, but it would reduce the anxiety we all experienced when we were going through all of that process. Today, in the practices that I oversee, it is a tool that is gaining popularity. When I tell you that I kicked and screamed when I got those emails from Mark Renfro and the IT, they would verify that. I did kick and scream. I really did not see the benefit. But daily, more and more, as I see the uses that there are for this product, I think, my gosh, if only in 1999 we had this product, it would have been so much easier. There's a lot of good information there, and it covers a world of possibilities for you and your patients. So 2019, you can see Pam's graphic there. It's much more complicated than those paper charts. The charts are real simple, but now we have access to all of these outside vendors. Your mother can go to Emory, and tomorrow or the next day, her primary care doctor can pull those records to know that her care was complete and what he needs to do on that particular end of her health care. Thank you. That's all I have. I appreciate it.
Sandy, thank you so much. That was a wonderful overview, and the heartfeltness associated with it shows how the combination of the technology can really and truly assist the family so that they can do the personal side that's necessary with their loved ones. At this time, and I would like to thank also Lynn, thank you for giving us the overview of GHIN. We'd also like to invite you to the actual next GAMUS webinar we're going to have. Our GHIN and our actual GHIN, we're going to work together again on November 6th. We're going to host Accessing GHIN through GAMUS. We're going to go through the details and show you all the benefits of the clinical viewer, so that with the clinical viewer, you will actually be able to see everything that Sandy just explained to you in greater detail. So a picture and the words together will really make it a better benefit. At this time, we would like to open up for any questions through our chat feature. By all means, anyone who is on our webinar right now, if you have a question for Lynn or for Sandy, please, by all means, type your question at this time and I will read them. And I will pause for a few seconds for any questions. Well, we do not have any questions at this time coming through the chat. We also actually have a webinar questionnaire that we're going to have at the end of this particular broadcast. We are asking for one additional question. We would like to know, where did you hear about our webinar at this time, so that we can actually track and see what other entities and where we can share this valuable information. And again, our very next webinar is going to be on November 6, 2009 at 11 a.m., accessing GHIN through GAMIS. By all means, please join us. At this time, at the end of the broadcast, you will receive the survey. Please look for that final question on the survey and give us your feedback on how you heard from us. We will look forward to the November 6th webinar with everyone. May everyone have a safe and healthy Labor Day. Thank you again for joining.
Thank you, Bonnie.
You're welcome. Thank you, Lynn, and also Sandy. Very good information.
Many thanks to Sandy. Great story. Thank you.